City, but from all over the nation to help our city in our time of need. We're dealing with a big challenge together, but we are certainly not alone, and there are so many amazing stories, people who want to help and are helping and are giving their all for New York City right now. And in a few minutes, I'm going to talk about an old friend who has returned, and we are so happy he's back, coming to our aid at the moment we need it. But first, let me talk to you about a conversation I had earlier today with the administrator for FEMA, Pete Gaynor. This is a man who the president has tasked with leading the effort nationally to ensure that the efforts to stop coronavirus are fully resourced in New York and around the country. So he's really leading this extraordinary mobilization all over our nation. And Administrator Gaynor was very focused, very concerned about the needs in New York City, very aware of the details of what we're facing. We had a long and detailed conversation. We went item by item related to everything we need here, timelines, specifics about how to get the job done, and also about how important it is to protect New Yorkers in this moment, to stay ahead of this, to recognize the challenges of the next few weeks and get the personnel and the equipment and the supplies in place in time. I think everyone knows I've talked about this Sunday, April 5th, as a crucial day, and I've done that for a reason. I want everyone to understand it. It's not to be alarmist. It's to focus the energies of our national government, to focus the attention of everyone who can help us, to help them understand how important it is to maximize support for New York City by this Sunday and then in the days immediately following as we prepare for a real upsurge. But I'm happy to say that Administrator Gaynor, I could not be more pleased with the conversation. The focus he showed on each and every item and the ability we had to determine together how we would proceed to the maximum. I express my thanks to him on behalf of all 8.6 million New Yorkers for everything FEMA has done already, and we are so especially appreciative for the amazing support we've gotten with the ambulances that have arrived and the EMTs and paramedics to help us address the challenges we're having. And I think a lot more help is on the way, so it's a very encouraging conversation. Now, I'm going to talk about our immediate needs, and I'm going to give you some real detail about what we need in the coming days. And then, of course, I'm going to be talking about the important work that Jimmy O'Neil is going to be doing starting immediately. But let me say, as I go into the specific numbers, and you'll hear, I should say also after my report, you'll hear from Dr. Katz, and he's going to go over some very specific updates related to health and hospitals, and then how we're going to be building out our hospital capacity in general. And then you'll hear from Jimmy O'Neil after that. But I want to emphasize how much effort has already been expended. It's unbelievable. If you look at what's happened over the last weeks, how many people have gathered together to provide support already. And again, the toughest weeks are ahead. But I want to tell you up front, hundreds and hundreds of people who have worked to ensure that the supplies we need have kept coming in. And I'll talk about them more as I talk about Jimmy's new role. But there are so many people at the Emergency Management Command Center in Brooklyn, folks from City Hall who are there at the command center and working remotely, who have played a crucial role, folks who work at Department of Health and Hospitals, in their warehouse, in their supply operations. So many people every single day are participating in getting the supplies where they're needed. We talked about huge distribution that happened yesterday. This is going to be an ongoing effort, and it's going to be like nothing we've ever seen in the history of the city, and a lot of people are making it happen. I want to thank all of them, and all New Yorkers should have them in their hearts, because this group, they're unsung heroes, but they're doing amazing work to protect all of us. Now, I want to talk about, since I've put Sunday, April 5th is that kind of demarcation line, that D-Day, by which we have to get ready this coming Sunday. Let me tell you where there is good news. And we said this Sunday to prepare for the entire week of April 6th ahead. There are two types of supplies that we're now confident we will have a sufficient amount of for the week of April 6th for all hospitals in New York City, for all first responders. And I want that standard to be really clear. We are all working together. Federal government, state government, city government, nonprofit organizations, charities, everyone's working together. When we think about our hospitals, we are thinking about all hospitals together. Public, voluntary, independent, we're thinking of all of them. Everyone is wearing the same uniform. We're also thinking about our first responders, who obviously need to get the protective gear, the PPEs when they need them. We have to make sure that supply is strong. So we are confident, based on all our projections, that for next week we will have sufficient eye protection. That means the face shields and the goggles, and sufficient surgical gloves for all those needs for everyone who's doing this crucial work, for all our heroes who are out there protecting us, for all those healthcare workers who are at the front line. We will have enough of those two categories. We need major resupply in some other categories. Now, I want to emphasize I say this. We have requests out to the federal government, the state government, to private vendors, to the many, many individuals who are seeking help. So when I tell you these numbers, it's against a backdrop of many moving parts already, many actions already to make sure we will get the help. But my job is to tell you where we stand, and I'll constantly update you as more supplies come in. So the need at this moment, here on this day, thinking ahead to Monday, we still need 3.3 million N95 masks to come in by Sunday to prepare us for the week ahead. We need 2.1 million surgical masks. We need 100,000 isolation gowns. These are big numbers for sure, but they are reachable numbers, but we have to make sure it happens in time. Now, those are all very, very important, but the area that I focus on all the time is ventilators. When it comes to equipment and supplies, the number one concern I have is ventilators, because they keep people alive and they give our healthcare professionals an opportunity to save lives. We have continued to get a very substantial supply of ventilators, but we still need 400 more to be in place by Sunday to prepare us for the week ahead. So we have many, many requests out, many efforts that are underway to get those 400 in place in time. That's to be ready for Monday. In the course of next week, and again, we have requests out to the federal government, state government, many sources. In the course of next week, we will need a minimum of 2,500 to 3,000 more ventilators. Now, extraordinary efforts are underway to tap into the supply all over the country and to work to see what we can produce here in this city. But that is the number we're working with at this moment for next week. There's also an ongoing effort to get personnel. This is a growing concern as we go forward, but again, one where we see a tremendous response. So many New Yorkers have volunteered, folks with medical training of all kinds. More and more volunteering come forward. They're being acted on right away. We'll talk about the many people who have been found, medical professionals been put under contract, who are joining us rapidly, and the request that I've made to the White House and the Pentagon for over 1,000 military medical personnel. I reemphasized that request to Administrator Gaynor of FEMA earlier today as well. I'll keep you updated on that. So many personnel needs, but also a lot of personnel coming our way quickly. But we have to always remember to keep building out that ICU capacity we need, to keep using those ventilators we need. We need the personnel to go with it. We also have to constantly think about giving some relief to the heroic folks at the front line right now in our hospitals. They need to see reinforcements come. They need a chance to get some downtime so they can finally recover from everything they've been doing, and then they can get back into this battle. So we'll keep an eye constantly on that personnel situation and update you regularly. So the bottom line, supplies continue to come in at a very rapid rate, and they go out right away to hospitals all over the city and to first responders. The speed has become remarkable. The turnaround time, very, very quick. To, again, all the hundreds of people, especially to that team at emergency management, all the folks from emergency management, from the agencies, from City Hall, my extraordinary colleagues who came together to create this rapid deployment plan of bringing in supplies and getting them out. I want to give you, again, profound thanks for what you've achieved. And we're going to need you even more in the weeks ahead. Now, I decided as we built out this apparatus that we wanted to bring in additional leadership and some of the best leadership anywhere in this country, and we know him well. He led with great distinction our police department. I was so proud the day I named him police commissioner. He did an outstanding job in those years serving us, leading an organization of over 50,000 extraordinary people and keeping this city safe. I'm going to talk about the role that Jimmy O'Neill will play, and it's going to connect exactly into what I've just told you already about everything we're doing to keep our hospitals strong. But I want to take a moment to express my gratitude because Jimmy's coming to aid us because of the willingness of his company, Visa, and particularly its CEO, Al Kelly, who's someone I've known for quite a while, who's someone who really loves New York City and cares about this place. I want to thank Al. I want to thank Visa for freeing up so much of Jimmy's time so he can do this crucial work. It's going to be truly life-saving. So a profound thanks to you. Now, that team, as I mentioned, the hundreds and hundreds of people who are moving the shipments constantly, that's been an area where we've seen tremendous strength and consistency. What I want to see now is absolute seamlessness in terms of how supplies, equipment go into our hospitals, immediately get distributed where they're needed in the hospital to the frontline workers, that we constantly are able to say exactly which hospital needs what at any given hour. I'm not talking about week, I'm not talking about day, I'm talking about any given hour, knowing exactly what each hospital needs so we can make those rapid moves, those rapid shipments, and ensure that within each hospital the distribution is strong and smart. And of course, we are being honest. We've always been honest. I know Dr. Katz will make this point as well, that as we get in supplies, we have to shepherd them. We have to make sure they're being used properly, support our healthcare workers with everything we've got, but also be smart about rationing what we have to make it last in this tough situation. I thought about all of those pieces, and I thought about the many different kinds of hospitals. And I think we've got some of the greatest hospitals in the world. Everyone knows that in this city. We've got our public health system, which has really distinguished itself in this crisis, and Dr. Katz's leadership and his team has been amazing. We've got independent hospitals. They're smaller, community-based hospitals, and they play a crucial role in our city, but a lot of them have gone through for years financial hardships. They often deal with folks with tremendous medical needs, but many, many times people who don't have insurance. So those independent hospitals are absolutely crucial in our ability to fight this battle, and a lot of them have struggled lately, no fault of their own. They've always been there for people in greatest need, but they need special help now. So I've asked Jimmy O'Neill to develop a system for ensuring that we'll have personnel in every hospital where they're needed to help make sure that this supply chain is seamless and constant and focused, that the supply usage is just the way it should be. And any hospital that needs additional help, we'll be able to get it to them quickly. Jimmy will assemble a team with folks from City Hall and other agencies so we can have that presence in the hospitals. And it will allow us to have a much faster, more precise communication and get people what they need when they need it. So I'm very, very appreciative. You'll hear from Jimmy in a few minutes. And now I want to talk to you about looking ahead this whole month of April. I've told you what we're trying to get done by Sunday. I've told you how we see next week. Next week's going to be a very difficult, intense week, and yet the preparations are very, very strong for next week as well. We'll keep updating you on that. But here's the overall situation. We've alluded to it many a time, but I want to just remind all New Yorkers about this. We're always going to need more of that supplies, that supply chain I talked about. We're going to need the masks and the N95s and the gloves, the gowns, all that. Every single week we're going to need more of that. We're going to need the ventilators especially, and that number that I've said from the very beginning, 15,000 for New York City, that number is a very specific number based on the projections we've had. That number continues to be the right number. I've told the President of the United States and everyone else I've spoken to in the federal government, that is the true number. And the second we don't need all those ventilators, we will happily share them with the rest of the country immediately. When it comes to hospital beds, again, the goal is to take the 20,000 or so. We started with the month of March with the normal complement of hospital beds in this city that were staffed with professionals all over our hospital system. Those 20,000 are increasingly going to become all ICU beds over the month of April. That's what our hospitals will be for more and more, taking on the toughest COVID cases at the front line. We need to build out during the month of April an amazing number of additional hotel beds, hospital beds, I should say. My apology, hospital beds. And hotels will be one of the ways that we achieve that. But hospital beds, we need to build out an additional number of 65,000 hospital beds in the city of New York by the end of April. We already have a tremendous start. The 20,000 beds, as I say, they were already there. Hospitals are now adding up to 50% more capacity, just drawing on all the space they have. And Dr. Katz talked about this from the beginning, the ability of hospitals to quickly build out more beds, more space, more ICUs. That number will add an additional almost 10,000 beds right there. Javits Center we've talked about, and Dr. Katz will go over this, thousands of beds there, and then all the hotels will bring online increasingly. So this is going to be an epic process through the month of April to build out that capacity. But this goal is within reach. It's going to take Herculean effort, but I'm confident it can be reached. So now, as I turn to Dr. Katz, we're going to talk about where we are today on our hospital capacity, the building out process, starting with our public hospital system. This growth pattern, this building out I'm talking about, is literally going on 24/7, and a profound thanks to everyone who's participating in it. So Dr. Katz is going to give you a sense of where we stand today and how we're going to be moving forward over the coming weeks. Dr. Mitch Katz.
Thank you so much, Mr. Mayor, and thank you for supporting the public hospital system. It's clear in this emergency how lucky we are that New York City kept open its public hospital systems, didn't allow them to close the way it happened in Philadelphia, in Washington, D.C., in Milwaukee, because in this crisis we so desperately need the public system. We have 324 ICU beds that we run under normal circumstances, and a total of 4,428 beds. And while those are very large numbers, they pale in comparison, Mr. Mayor, to what you showed us we're actually going to need in this crisis. But we are prepared to meet the crisis. In our immediate surge to handle it, Elmhurst Hospital, which is on the forefront of handling COVID patients. It's in an area of central Queens where a large number of districts depend on this hospital because there is no other hospital near it. It has already increased from 29 intensive care beds to 111 intensive care beds, and so that's in the matter of 10 days. I mean, these are changes that you would expect under normal circumstances would take 6 months to a year to get the beds in place, to get the staff in place, to get the equipment in place. Every single one of these beds represents a courageous nurse taking care of the patients, courageous physicians, and all of the support. Intensive care patients need a great deal of support from pharmacy, from transport, from radiology. It's a tremendous effort to take care of each intensive care unit patients, and yet Elmhurst has magically gone from 29 to 111 beds. At Lincoln Hospital, they've grown their ICU from 34 beds to 114 beds, with 30 more coming there. And Bellevue Hospital has grown from 66 to 127, with 52 more coming. And this is really just the beginning of what we need in order to handle this emergency. We have, in order to deal with the fact that COVID-19 patients have not appeared evenly across our system as the epidemic hits different parts of our city at different moments. Also, we recognize that some areas of our city, like Queens, have markedly fewer hospitals. So it's not just Elmhurst Hospital, but Queens Hospital that has also been hit extremely hard by patients and very sick patients. So in order to be able to do this, we have transferred 193 non-ICU patients and 43 ICU patients from the hospitals that have been most affected and moving them to hospitals where we've had greater capacity in the last few weeks. So we've been moving patients to Coney Island Hospital, to Jacoby, to Harlem, to Metropolitan, and the North Central Bronx have all taken patients in order to make sure that we are able to provide care for every patient who needs it. Every hospital, and I speak to them every night, knows exactly what space they're next going to open during the night. We've seen a large number of patients needing intubation come in the evening hours. So we open the units often in the middle of the night in order to accommodate them. But in every case, we know what those surge wards will be. It fits with the very plans that we started working on in January and February when we first saw the data coming from China. We recognize, Mr. Mayor, that while these are huge efforts, they won't meet the needs as you've outlined them to New Yorkers. So in the short term, we're going to bring on an additional 762 intensive care beds for a total additional beds of 2,466. And again, while these numbers are astronomical, they don't add up to the numbers that you showed New Yorkers of what's going to be needed. We intend to convert all of the hospitals into intensive care units because an intensive care patient relies tremendously on the ability of the laboratory, on the pharmacy, on equipment, radiology. You cannot create an intensive care unit, a bed, in a hotel. But what we can do is turn our facilities into large intensive care units and then use the hotels and the other alternative facilities for medicine patients who do need support but don't need the same level with ICU need. This is going to require huge influx of equipment and even more importantly of staffing. The issue is not one of spacing, and we've said this right from the beginning. There are many places in New York City that would be available to create additional space. The challenge is having the staff, having the equipment, and in the case of intensive care units, having all of the other services that would be necessary in order to keep people alive. So it's our commitment to you, Mr. Mayor, that we are going to do everything working with you and all of the great people in New York City to achieve this. In order to reach just what we've done so far, we've added 165 physicians, nurse practitioners, physician's assistants to the system. We deployed 1,000 registered nurses. We have another 1,000 registered nurses coming within 2 weeks, and we've added another 350 physicians, nurse practitioners, and physician assistants that will be coming in the next week. But this will still, again, not be sufficient. We will need a great deal more staff than this to be able to successfully increase by the number of intensive care beds that New York City is going to need. We're doing everything possible to support the incredibly brave nurses and physicians and support staff of every kind who are working long hours, often watching their own coworkers become ill. It creates a tremendous sense of distress to both be working hard and know that coworkers have gotten sick, but people are bravely working on. We want to do everything possible that we can to support them. We're making sure that there is COVID-19 testing available free for any of our frontline personnel. That's starting at our occupational health clinics. We've received more than $1.6 million in donations to provide comfort items to our frontline staff. They can't take any breaks to go out to get food. That's not even in our rule book about how you get through these kinds of crises. So having people give us donations so that we basically can bring in food for all the shifts of workers. People do need to eat, and we are very grateful. The rooms in the hotels, many people who are working 12, 16 hours in around many patients with COVID do not feel comfortable returning home to their spouses and their children. So we have provided hotel rooms so that they can go to a place where they feel they can get rest without putting their families at risk and come back the next day. We're providing taxi rides. You, sir, had provided parking vouchers for people so that they can park their cars easily. Our Helping Healers Heal is extending emotional, psychological counseling to healthcare workers in dealing with the stress. Having your patients die despite the very best efforts is so distressing. This is a very fierce disease for a very small number of people. We've put up for people who wish to donate to support your healthcare workers at nychhc.networkforgood.com. And we so much appreciate the support of all of the first responders, fire, EMS, the police, the people at the Office of Emergency Management who have been getting us supplies and keeping us going. In terms of additional surge, Mr. Mayor, would you like to speak about these facilities? Would you like me to speak about them?
I'll just say broadly, Mitch, you can talk about some of the specifics, but broadly, when you look at this list, remember, everyone, this is a series of facilities that just days ago were not outfitted to provide health care. So if you go through the list, and Mitch will talk about it, but every single one of them is either a place that was doing something totally different or is something brand new in this city. Obviously, the most powerful example, the most compelling example, which we all are feeling, is the presence of the USNS Comfort. So Mitch will talk to you about the specifics that we have already moving, and then I'm going to talk about how we're going to turn more and more hotels into hospitals. So you start, Mitch.
Sir, I had the pleasure of going to Javits Center and seeing a tremendous number of staff who are willing and able to take care of patients to help us to unload our hospitals so that we can focus on the intensive care unit of intubated patients located on the west side of Manhattan in Phase 1. 1,000 medical surgical beds are currently available, with another 1,500 medical surgical beds to come in late April. Samaritan's Purse, located in Central Park, with additional support for Mount Sinai, 65 beds, 10 intensive care unit, and 55 medical surgical beds that we believe will come up in 24 to 48 hours. We were all so proud to see the Navy bring the Comfort ship located in Western Manhattan with 750 medical and surgical beds and a crew of phenomenal physicians and nurses who are prepared to take care of patients. At one of our own facilities on Roosevelt Island, we were able to open up 240 medical surgical beds. We already have more than 25 patients who are being taken care of in that facility, and during this week, we will fill it up. We have, I know you were yesterday at the National Tennis Center located in Corona, Queens, showing New Yorkers that you've prepared a facility that can take care of up to 350 medical and surgical beds. At Brooklyn Cruise Terminal in Red Hook, we believe it will be possible to create up to 750 medical and surgical beds that will go up in mid-April. And then finally, we know that the hotel industry is capable of providing us with a large number of rooms. We so far have secured 10,000 beds in 20 hotels, and we believe that the capacity is there. Again, staffing will be one of the things we will most work with you, Mr. Mayor, to be sure that the people in all these facilities are fully cared for.
Thank you very, very much, Mitch. And get ready. I'm going to come back to you on the way people can donate to your frontline healthcare workers, so get that website ready again. But let me first say, so think about the amazing, fast, intense, passionate effort that's being made here to expand our hospital capacity in record time. Nothing like this has ever happened, literally, in the history of New York City. Let's go back to that previous slide. I want to work off of that. Again, think of where we started. We started the month of March, 20,000 staffed hospital beds in what everyone would say is, that we're the finest hospitals in the United States of America. Take all the hospitals in New York City, take all the professionals, all the amazing talent. This is where so many of the doctors of tomorrow train for the whole nation. That was an amazing place to start. No one could have imagined a world in which we'd have to build out so much so quickly. But now, when you think about the fact that those hospitals, that with their 20,000 beds, are basically adding 10,000 more within those hospitals. You look at what Mitch has reviewed on this slide before us, the thousands of beds at Javits, the USNS Comfort, like adding right there in that ship, like adding another major hospital to New York City. All these different pieces are starting to add up, and then we go to the hotels. So the fact that right now, with the hotels we've already identified and contracted with, and I want to thank everyone in the hotel industry, by the way. I want to thank the owners of the hotels, the managers of the hotels, the people who work in the hotels, the unions who represent the people in the hotels. Everyone has been working shoulder to shoulder to speed this effort because it has to happen in record time. So right now, we already have accounted for 10,000 additional beds. You take the 20,000 we started with, the 10,000 more we're adding in the hospitals themselves. Look at 10,000 more already from the hotels. They'll be coming online soon. That's 40,000. The thousands more you see on this slide in specific locations. And we're going to keep building and building. The key going forward is going to be more hotels and more big spaces. We've got, obviously, in the case of the Javits Center, in the case of the Billie Jean King National Tennis Center, in the case of the Brooklyn Cruise Terminal, these are large spaces where you can do hundreds of beds at a time, or in the case of Javits, thousands. We're going to be looking for more and more spaces like that. I know the state of New York is also doing the same, and we're all coordinated. We're dividing labor. They've got major spaces that they'll be working on. The city will be adding our own. We've been getting tremendous cooperation from the private sector. Again, I'll tell you the day we ask someone to help fight the coronavirus and they say no, but I have not had that day yet. So in terms of finding the additional beds we need, we believe there is enough major venues, bigger spaces in New York City that we can retrofit, and we can do that quickly. And we're working with folks in the construction trades, contractors, folks in real estate. They're all saying yes. They're all quickly helping us get this work done. And then those hotels. And I'm very, very sorry for what the hotel industry has been through in this crisis. A lot of people have been put in a tough situation to work in our hotels. They're obviously struggling. But what it has meant at the same time is a huge number of hotels have become available to the city of New York. And literally, we can go in and lease an entire hotel building. And we can do that dozens and dozens and dozens of times until we get to the point that we have all the beds we need. So that is the game plan. It's going to be furious and intense, but we're going to get it done. And I'm so grateful that everyone's a part of it. As I say a few more words, and then we'll turn to Jimmy, I want to remind people, again, if you're able to help our frontline hospital workers, these heroes have been doing so much, and Mitch's folks in the public hospitals have borne the brunt and they've done amazing work. Mitch, one more time, what's the website people can go to if they just want to give those direct donations, the food and the other things that'll help your heroic workers get through the day? What's that website again?
Thank you, Mr. Mayor. It's nychc.networkforgood, all one word, .com.
Say it one more time.
nychc.networkforgood.com.
All right. And then to all New Yorkers and anyone in the country who wants to help New York City with equipment, with supplies, who wants to volunteer their time, reminding you, anyone can call 833-NYC-0040. 833-NYC-0040. And we are so thankful for the help. So let me pull this all together. I think we've known for a long time that New Yorkers are the strongest, the toughest, the most resilient, and in a crisis, we show what we're made of, and it's happening again in an amazing way. I don't have to say again what our doctors and nurses and healthcare workers are doing, our first responders. They've been exemplary. Our companies, the private sector has stepped up in a huge, huge way, donating so much to help our frontline heroes. What's happening now at the Brooklyn Navy Yard is an example. It keeps coming back to me, really touches my heart. And please go see the video that we've had on my Twitter feed on this at NYC Mayor. It's unbelievable to see a wartime factory in the Brooklyn Navy Yard making those face shields to protect our healthcare workers and our first responders. And there's more going on in the Brooklyn Navy Yard we'll be talking about in the coming days. But the fact that PPEs are being built right here in New York City by hand, each piece built by hand, labor of love to help their fellow New Yorkers is so moving, so extraordinary. Everyday people who are donating food to Mitch's colleagues who are purchasing and donating masks, gloves, you name it. It's been nonstop. So this virus is tough. This virus is going to give us a real battle. But this virus is no match for the people of New York City. This city is strong. We will get through this. We will get through this together. We will come out the other side an even stronger city. And I mentioned that we are blessed to have help always. And I want to talk about that, but I realize I first need to just say a few words in Spanish just to summarize. Durante las últimas semanas, hemos estado enfocados en ampliar la capacidad de nuestros hospitales. No será fácil, pero necesitamos miles de camas más en nuestros hospitales. Con cada cama, podemos salvar vidas y apoyar los trabajadores de salud. So everyone, as I said, help has been pouring in from around the country. And I got some help a few weeks back from San Francisco. The second San Francisco put their shelter-in-place order out. I thought that looked like the model we should follow here in New York City immediately. But I wanted to make sure it was functioning in a way that would really protect people, make sure we could get ahead of this virus, and also work in terms of people's day-to-day lives. I needed an eyewitness to tell me what was happening in San Francisco and someone I could trust to confirm that it would work here in New York City. And once I got that confirmation, I said that this was something we had to do right here. Well, that eyewitness happened to be none other than our former police commissioner, Jimmy O'Neill, who has been based in recent months in San Francisco working for Visa. And not just every day, but it seemed like every hour, Jimmy was sending me reports, updating me, telling me what he saw, telling me what he thought would work. And then a few days ago, he reached out to me and he said that he would be coming back to New York. And he said he was ready to serve his city again in whatever capacity we needed, no matter how big or how small. And I said to Jimmy that knowing the amazing ability he brings, we need him to take on a major, major role. And we talked about all the ways he knows this city, and he knows this city so well from his 35 plus years on our police force. He's been in every hospital. He's been in every neighborhood. He knows the people of this city so deeply, he cares so deeply for this city. And so I talked to him about this vision of ensuring that not only did supplies get to the hospital, but that we could really make sure everything was being used ideally and that we could resupply instantly whenever hospitals needed it, needing a leader of that effort to create that network of professionals that we could work with to really make that precise and hone that. So I can tell you that Jimmy O'Neill has answered this city's call before, and he's answering the call again. And it is just a great honor to welcome him back, our former police commissioner and now my senior advisor, helping us wage this battle against coronavirus. Welcome back, Jimmy O'Neill.
Thanks, Mr. Mayor. It's an honor to come back to New York City. First of all, I want to thank Chief Bill Scott from San Francisco PD, who provided me with a lot of the intel of what was happening, and plus I took a couple of trips into San Francisco myself. And I wish the people out in the West Coast all the best. You know, it's just it's the responsibility of all New Yorkers to do their part. I always felt that way, and I continue to feel that way. And I want to thank Mr. Mayor. I want to thank you. I want to thank all the great people at Visa that I've been working with over the last 4 months, and I will continue to work with. And I really want to thank the CEO, Al Kelly, for giving me the opportunity to do this job and to do my job at Visa. And it's important that we all come together as New Yorkers. It's one thing I saw in my time as a cop. You know, this is a resilient city. Everybody's supportive. You know, lately, I've just been seeing, reading, hearing about all the great work that's going on in New York City right now, and I just felt compelled to come back and offer to help and do whatever I could. And basically, what I'm going to be doing is I'm going to be helping to managing the supply chain, making sure that there's an inspection regime, make sure that we're sourcing, delivering, distributing, and tracking to make sure that we do our best, continue to do our best for the healthcare workers that are out there right now, this very minute, doing their best to save lives. It's a system of accountability, and we have to make sure that it's operating efficiently. Just before I wrap it up, you know, some of that equipment is N95 masks, surgical masks, isolation gowns, face shield, goggles, all the equipment that our healthcare workers need. Just really, I'm truly inspired by what I've seen over the last 2 months. The doctors, physicians' assistants, nurse practitioners, nurses, all the other workers in the hospital. Now we have the military involved. Thank you to the Navy, the state police, the Port Authority police. These people truly are an inspiration, and I'm thankful for them. And last but not least, I want to thank the men and women of the NYPD who continue to keep the city safe in spite of everything that's going on right now. They're out there answering radio runs, doing their best to keep people safe. And I like to commend Commissioner Shea. What a great job that you're doing right now. So how could you not want to help this great city? And I'm going to do my best, and thanks for giving me the opportunity, Mr. Mayor.
Thank you very much, Jimmy. Your best is very, very good. So I know with you here, our healthcare workers are going to get even more support, and I want to thank you. It means a lot to all of us in this city that you're back. Okay. With that, we are going to turn to questions from the media. And Olivia, you're going to let me know the name and the outlet of each caller?
Yeah, just have 3 quick programming notes at the top. The first is we're going to do 1 question per reporter to get to as many outlets as possible. Also, if reporters have additional questions about hospital capacities, we are going to have a technical briefing with Dr. Katz after this press conference. You can save those questions for later. And finally, Commissioner Shea is on the phone.
And Olivia, just to clarify that reporters who want to be a part of the technical briefing should just stay on the line after?
Yes.
You want to do that? Okay. And Mitch will stand by when we finish the main portion of the press conference. And welcome to the call, Dermot Shea. And we will go ahead now with the first question from the media.
Gloria, you're up first. Gloria?
And from New York
Hi,
1.
guys. Can you hear me?
Yes, Gloria.
Hi, Ms. Mayor. Thank you. First, I want to ask a question about Queens specifically. And I know that you have been talking about the increased cases that we are seeing there. But I wondered if for Dr. Katz, if there's anything that you guys as health professionals have found about why there is such a concentration in Queens specifically. And I understand you mentioned today the lack of hospitals, but is there anything else to it? We have been getting some reports today about the situation at Elmhurst, specifically about the lack of ventilators. And I'm wondering if there's any detail from today that you can give us an update on in terms of what the current status is there as it pertains to ventilators at that hospital.
For the ventilators, there are enough ventilators right now for Elmhurst and all of our hospitals. As the mayor has been very clear, we have enough ventilators in New York City until Sunday. Beyond that, we're waiting to get help from the federal and state governments. I think any time people, and we've had at various times at various hospitals, people think that there aren't enough ventilators. That's because at any one area of the hospital, such as within the emergency department, they may not see all of the ventilators that are there in the hospital physically. But I check every night myself before I go to sleep. I look at how many ventilators each hospital has, and I'm sure that they will have enough to get through the night, and I restock every single day. So we are totally on top of it, but the issue that the mayor has pointed out is that will not go beyond Sunday when we will exhaust our supply. In terms of why Queens, I think the clearest answer, and we've looked at this, is that Queens has about half the number of hospital beds per 1,000 persons than Manhattan. And especially where Elmhurst is. There is a huge area of population that are extremely dependent on Elmhurst. It's the hospital that's closest. Is also a hospital that's very well regarded, where immigrants and the uninsured feel safe to go. So that also plays a role into why people go. And then finally, although it will be a while before we fully understand all of the aspects of the epidemiology, we know that in Queens, many families, because of poverty, live together in very close quarters. So that while we are practicing as a city social distancing, you may have multiple families living together in a very small apartment. And so it's easy to understand why there's a lot of transmission of COVID occurring.
Henry from Bloomberg is up next. Henry?
Hi, can you hear me?
Yes, Henry.
We're coming up on some religious observances, and I want to know specifically whether the city is going to exempt some groups of people, some size of groups. Is there any policy that's set forth?
Henry, just to clarify, do you mean for religious gatherings?
Yes, the Seders, the Easter